The CDC's guidance for schools to fully reopen this fall and to allow fully vaccinated students to go without masks is yet another sign of how the U.S. is shifting its approach to the COVID pandemic. But even as the push for regular routines grow, the Delta variant presents its own risks, especially to those who aren't vaccinated. Some states in the South and the Midwest have low vaccination rates. Stephanie Sy looks at one dealing with a spike in cases, Missouri.
Judy, Missouri is one of those states where the Delta strain is leading to a rise in cases. It's among the top 5 states when it comes to new cases and hospitalizations. Missouri has reported nearly 7,600 newly confirmed or probable cases in the past week. Fortunately, the number of reported deaths remains low, only 7 confirmed in the past week. But there are regions, particularly in the southwest part of the state, where vaccination rates are well under 35 or 40%. Hospitals in those areas are grappling with serious illness and a strain on resources. Eric Frederick is the Chief Administrative Officer at Mercy Hospital in Springfield, Missouri, joining us now. Mr. Frederick, thank you so much for being on the NewsHour. Describe what you're seeing at your hospital and how it compares to the height of the pandemic last winter when many hospitals around the country were overwhelmed.
Yeah, thank you, Stephanie. I appreciate you having us on and giving us this opportunity. I was looking at the numbers earlier, and just to put it in perspective, we have 2 surges, one last year and now the current one. Mark this current surge starting on June 1st, where our inpatient census for COVID was 26, and today we're at 128, which is the highest census we've had the entire pandemic. So 39 days to go from 26 to 128. Last year, our peak started on September 1st. It took us 150 days to make that same escalation. So it's alarming to have your patient census with COVID grow that fast over such a short period of time. We've had plans in place the entire time, but the ability to deploy that plan even faster than we did last year is where that strain came on our resources over the last couple of weeks.
Well, let's talk about that, Mr. Frederick. What shortages, if any, have you experienced to care for these new patients? I understand that having enough ventilators has been an issue.
We certainly strained our ventilator resources last week, and we pushed them to the edge. We have a number of ventilators that we keep on hand, and with some additional resources like transport ventilators should we have to move patients. Our plan allows us then to reach out across our ministry. Mercy is a pretty large system with multiple hospitals, and part of our plan is to be able to lean on our sister facilities for some of their resources should we need them. And so we saw a rapid escalation from Thursday through Saturday, and we really pushed right up against our on-hand inventory right up until we were know that we were going to be utilizing that last ventilator. We pulled that part of our plan out and quickly rallied some resources, and they were delivered on time. So the good news is we never had a gap where we had patients that needed resources we didn't have, but we had to act pretty quickly, and luckily our plan allowed that to happen. As of today, we have plenty on hand for this continued rise, and we can get to more if we need it.
What about ICU capacities, staffing shortages, or any of those issues at this point?
Yeah, so from a bed capacity, we've got beds. We have stretched our ICUs. During the peak last year, we really had 1 dedicated ICU for COVID patients. This year, what we've found is we have to stretch into a second. So we're really looking at 2 dedicated COVID ICUs, and then we have a 3rd ICU that we have for those non-COVID patients. And actually, it just stood up a 4th ICU. It was a closed unit that hadn't been utilized in a while, so we stood that back up for some flex capacity as well. So that takes additional resources, equipment, other beds. We have multiple COVID units for different acuities of patients. So those that are less sick but still have COVID can be moved around the hospital. But you hit on it, ultimately it's a staffing issue, right? So I think we hear a lot from people that say, we've got plenty of beds. I've had people in the community say, how can you be stretched and you have 800 something beds? And, people I think don't realize that beds are not just beds. They're specialized beds. There's behavioral health beds. There's pediatric beds. And when you really get down to the number of beds you have to care for this type of patient, it's not all the beds you see on the license that's hanging on the wall. And so, and then ultimately what it comes down to is do you have the staff to put around that bed? And that's what really, you can have all the beds in the world. And if you don't have the nurses and doctors and technicians, then you can be in a bad spot.
Well, I'm glad you have the staff, but I did read that there are a lot of patients in the ICU. In fact, I saw you tweet more than 80% of them are on ventilators, a lot of severe COVID cases you're dealing with. Out of those cases and deaths, Mr. Frederick, are those all unvaccinated people?
Yep. So definitely the percent of ICU patients on ventilators is alarming. I think it was 88% is what I had counted the other day. Today we're a little bit lower than that, but still above 80%. That's not what we saw last year. It was usually around 40 to 50% of our ICU patients were on ventilators. I will say, as we keep toll of who is vaccinated in house and not, what we're seeing is less than 5% of our patients are fully vaccinated. And none of those patients to date have ended up in the ICU or at the highest level of care. So even though there may be some that are vaccinated, the numbers are pretty low, and they usually end up in our lower level of care, recover and go home. I'm not aware of any that have died in our facility at this point.
Eric Frederick at Mercy Hospital in Springfield, Missouri. Mr. Frederick, thank you for your time.
Thank you. I appreciate it.